This is the treatment group video for separation anxiety disorder. My name is Dr. Danielle Hicks. My client is Trina Gable and she's 9 years old. We had only one differential diagnosis, which was separation anxiety disorder. And separation anxiety disorder only had one primary diagnostic feature, which is a person with this disorder experiences inappropriate and excessive anxiety regarding separation from home or people to whom one is attached. Now on to Trina's story. Trina again is a 9-year-old girl. She was referred to the school counselor for refusing to go to school and frequent complaints of being too sick to go to school or stay at school, even when she did not have any bodily symptoms. Her difficulties began about 6 months ago when all of a sudden Trina started making claims of having a tummy ache or that her head hurts. She was taken to the pediatrician by her mother, and the pediatrician reassured that there was nothing physically wrong with Trina. The pediatrician suggested that Trina's mother take a firmer hand with Trina and insist that she attend school regardless of her crying and clinging to her mother at drop-off time. Her mother and teacher would try giving rewards to Trina in order to stay in school, but none of their strategies worked. In addition to her claims of sickness and temper tantrums at drop-off time, Trina has also started having nightmares regarding the safety of her mother. When asked to draw a picture of her nightmare, she immediately begins to cry and says that she's too scared to draw a picture of her mommy dead. These nightmares started right after her father and mother announced that they were going to be divorcing and her father moved out of the house. Since her father's departure, she has been in very little contact with him. Her contact with him has been limited to the times that he has dropped by the house to repair a broken rain gutter and drop off some money for her mother. Initially, when asked about her dad, she would refuse to answer the questions of where he was and act as if the question had never been answered. Her mother expresses concerns that due to Trina's constant missing of school, she may have to repeat the 3rd grade since she's falling behind in her coursework. And that's Trina's story. Now on to the multi-axial diagnosis. On axis 1, we have separation anxiety disorder. On axis 2, we have none. Also on axis 3, we have none. But on axis 4, we have recent abandonment by father after parents' divorce. And on axis 5, we gave Trina a GAF of 58. We also have 3 theoretical perspectives. The first one is Psychodynamic Perspective. The recent separation of her parents and father's abandonment may have resulted in an unconscious conflict for this client. Trina is using the defense mechanism of repression as evidenced by her refusal to even respond to questions about her father and absence of asking about her father. Her inability to deal with her abandonment issues may have resulted in her clinging to her mother and fears of death of her mother. Behavioral perspective. This client's symptoms may be the result of a faulty learning experience, operant conditioning. Trina's avoidance of going to school is negatively reinforced because she is able to avoid the anxiety that results when she is separated from her mother. The client's clinging behavior is positively reinforced because she experiences feelings of security when she is clinging to her mother. And finally, the cognitive perspective. Trina's irrational beliefs regarding harm coming to her mother resulted in her need to be with her mother at all times. Whenever she had to separate from her mother, her irrational belief was activated and she would cling to her mother. And that is the treatment group video for separation anxiety disorder.